Genital atrophy. So people who swap their estrogen hormone profile to have a testosterone hormone profile will find that they get vulval and vaginal atrophy. So the skin in the vulva and around the entrance to the vagina and inside the vagina will atrophy, which means it kind of shrinks down or withers away. It can get very thin and very dry, and that can cause irritation, cracking of the skin, discomfort during intercourse. The vulva thrives on an estrogen hormone environment, and if we take away that estrogen, then the skin in that area will suffer. For transmasculine people who have fully swapped their estrogen profile for a testosterone profile, who are suffering with symptoms down below such as thin skin or irritation or dryness, may find that just some local estrogen cream, so just estrogen cream just used down below, can help just the skin in that area to recover and to take away some of those symptoms of irritation or dryness or bleeding or cracking, and may have things like having smear tests or having intercourse penetration much easier. So that's and there's very minimal absorption of that estrogen. So you can have a testosterone hormone profile going through your body, but have that estrogen cream down below just to have a local effect on the skin of the vulva and the vagina and around the anus. Conversely, people who have their testosterone profile switched to an estrogen profile will find that when their testosterone levels drop, their testicles will shrink, and also the penis will get smaller and have less function. That is again a symptom, if you like, or an effect of switching your hormones from testosterone to estrogen predominance. What can we do about that? It doesn't cause so much problem as the vulvitis that people who are used to having an estrogen profile would have had, but it can cause problems with sexual function in those trans feminine people who still want to use their penis as for sexual pleasure, either for themselves or for their partner. So what can we do? The Viagra type drugs, the PDE5 inhibitors, they can be very effective at maintaining function if that's what's needed. For some people it doesn't work, and we just have to accept that the testosterone environment is what was designed to make penile function adequate and effective. And if that's not there anymore, then that part of the body just might not work as well as it used to, and that might be one of the unwanted or wanted effects of swapping hormones from testosterone to estrogen. There are a number of different erectile dysfunction medicines that can be used, from pellets to injections to tablets. So if penile function is something that's very important to somebody who has taken trans feminine hormones, then try lots of different things and see if you can find one that works for you.